My name's Mary Vanderhoop, and I'm here to talk to you about a more humane and efficient way of docking tails in the veterinary clinic practice. For many years, people have been docking tails of dogs for many different reasons. Most are cosmetic, for showing, some are for hunting dogs. They do this in two ways. One, which is the most common, is surgically removing tails, which requires no anesthesia and is done when the puppy is about 2 to 3 days old, in hopes that they won't feel or remember the pain. The other way is what I'm proposing all clinics do, which is to cinch off the tail with a rubber band to cut off circulation and let it fall off in a matter of days. There are a number of ways that surgically removing tails can cause problems. They can cause behavioral problems, psychological problems, and health problems, and I will discuss all of these. I will then discuss my solution, talk about the budget, talk about the conclusion, and then answer any questions or comments anyone has. As we know, dogs greet each other by sniffing their hind ends, and they can also tell whether a dog is happy or sad or angry by the stature of their tail. If their tail's wagging, it's most likely happy. If it's down or tucked under, they're scared or frightened or sad. Dogs with long tails are better at giving out information such as mood and social status, according to the AVMA. Dogs with shorter tails can't do that as easily. Of course, a dog with a tail that's only 2 inches can't tuck it between its legs to show that it's afraid. And dogs need this sort of cue to be able to socialize with each other in a positive manner. Psychological problems. A study was done in 1996. They recorded the way that 50 puppies reacted to having their tails docked. Every one of those puppies demonstrated a series of vocal ranges that indicated that they were experiencing pain. Even though they're only 2 to 3 days old, and many people claim that they just can't feel pain, that simply isn't true. If you were to experience this yourself, as I have, you would never say that they can't feel pain. They whimper, they yelp, they cry. It's awful. This can affect them later on in life, as even though they may not remember it, their bodies still do, and it will affect them mentally, as someone with PTSD might be affected. There are many health-related issues that can occur due to surgically removing tails. Dock tails, according to Pagan of WebMD, can develop a neuroma. This can cause pain and make your dog snappy if her tail is touched. So a neuroma is basically a nerve problem that causes tingling sensation at the base of the tail or the tip where it was removed. And of course, we have the problem of infection and bleeding out early on in the procedure. Infection because it is an open wound, bleeding out in case you hit a vessel or a vein or an artery. I'm here to talk to you about a solution. There is something called an elastrator. You use rubber bands at the tip. You widen the rubber band to fit over the tail. The tail goes in, you release it, the rubber band ties around the tail at the desired length, and in a matter of days, the tail will fall off, as it doesn't get any blood flow or blood supply and is eventually just dead tissue. There's no pain involved, minimal risk of infection as there's no open wound, and of course it's pain-free. It's more affordable procedure as it's not considered a surgery because there's no cutting, there's no suturing, there's no cleaning up afterwards. It's a simple rubber band around the tail. And of course, clients will be happy about that. It's pain-free and quick. Of course, it might feel a little bit uncomfortable at first, but once they lose sensation, it's like it's not even there. It's quick because you just slip the rubber band on and you're out the door. Reduced risk of infection, again, because it's not an open wound. So the budget is pretty decent. The elastrator, which again is the instrument used to place the rubber band over the tail, is only about $32.30. The rubber bands, which you can get in a package of 50, they're specialized rubber bands. They're not just any old rubber bands you can get at Staples. Those are $4.65. Training to use these shouldn't take much as it is a simple procedure that should only be about $100. And the total should come up to $136.95. And that works for everyone. It works for the clinic, it works for the clients. In conclusion, of course, it's a fast procedure. You don't need to go down to the surgery table and get all scrubbed up. It's pain-free, and there is a reduced infection risk. Are there any questions?